We did close in March, as many local organizations did, um, to get our arms around, what we were dealing with, and started thinking really quickly about safety precautions, and worked with the CDC as well as many other local health officials to determine our reopening plans. Access is integral to everything we do. We're always thinking about um, how to make artwork more accessible to a broader number of people. If you think about our attendance being down, in some ways, that is painful to know that people can't travel from across the country right now. However, it has made us think creatively about how we're getting our artwork out online. We reopened June 10th and did have a set of guidelines that were approved by the state of Arkansas. So basically, we were really thinking about the number of people. So that was the first consideration, was really to limit the number of people so that it was easy to social distance. So essentially, we put a max on about 30 visitors per 15 minutes. Then, of course, enforced all of the basic CDC recommendations. What we did internally was really to create this touchless experience and no tickets. During this time, we haven't printed any physical tickets, so everything's happening on your phone or electronically. It hasn't changed much since we reopened in June. We're still, being pretty strict and enforcing it, but we've had a great response, and people feel safe and comfortable and are getting that inspiration from the art experience. So it feels like a win-win for our community. It just really depends on the artwork and the artist. I will say it's been a challenge with, people that aren't local, because travel in general is very challenging right now. But overall, the installation process hasn't changed. We have just been extra careful to be able to have the right amount of people working in a certain space. As you can see, I'm at home, so I have mostly been working from home during this time, and many of our administrative staff has transitioned to working from home. Many of our frontline staff, of course, security and our guest service team, volunteers, have continued to be on site. And so their work life looks different in terms of the protocols and the safety guidelines, but they're still able to interact with visitors, which is what they love. Even if someone is not able to physically come to Crystal Bridges, there's still ways they can connect and engage in art and conversations about art. For example, when we first were closed and didn't have any way for people to interact with the artwork in person, we started creating a hashtag CB from home to push out the content that we already had, and then create additional ways that people could engage with art. We have expanded our community outreach. So thinking about people that are vulnerable or isolated. We had one campaign called the Social Connecting Campaign, which we enlisted 9 local artists to create artworks around the theme together, and created postcards and put out, 5,000 or so postcards into the community. And then those then went out to people that were isolated in hospitals or senior living facilities. This kind of invisible impact of art experiences and inspiration and the healing properties of being around artwork that maybe haven't been researched as much. But certainly we hear from visitors that, this has been really important for emotional and I guess social well-being, to be able to have a place to connect and a respite, and just be able to have those inspirational moments with artwork. And so I think like the impact is immeasurable in that way. So I hope we're providing that for the community.